In this video, we're going to cover my 5 favorite stretches for neck stiffness. I'm Sebastian at Performance Place Sports Care, part of the locally world-famous chiropractors in Costa Mesa, California. This is a follow-along video. I'd like you to come back to it on a daily basis for a month. We're going to supply a countdown timer in the corner, and this is to make it really easy on you to get the exercises done. These 5 exercises are ones that we oftentimes suggest for people dealing with neck stiffness at Performance Place. They might not be the right ones for you. If you want particular suggestions for your specific scenario, you can always contact us. We have virtual and in-person sessions. At the end of this video, if you'd like to learn a little bit more about why these exercises work, we're going to cover a small anatomy and mechanics lesson so you can get a better idea of what is going on with you. The first exercise we're going to try is called chin tucks. I'll show you this way first so you get an idea. We're going to take your chin and push it backwards and return it. Okay? Act like your chin is on a thin pane of glass. Slide it off the glass. Don't break the glass. Don't lift off the glass. Slide it off the glass, like so. This is a really nice way to stretch the subocciptal muscles. If you do it well, as you can see, I'm having trouble talking because you're going to go so far back. You go so far back that you can feel that you're in the end part of the range. And a lot of times people feel the stretch right up in here too. Okay. One way to do this first as well, as we're finishing off, is I like to show people on their bed and they can push their chin back into the bed. Now, if you have a hard surface like the ground like me, people tend to tuck their chin, which is not ideal. So we're going to push backwards like so. The next exercise we can do is going to be a stretch of the levator scapula muscle here. And so we're going to start by moving our chin down, our nose down, and then checking our opposite armpit to see if we have any deodorant in it. You might actually, when you're down there, you take a little bit of a sniff. Yep, wearing some today. Okay, so normally I have people kind of do the movement of it first for the first 30 seconds, or until they don't feel like a zing. Like, you shouldn't feel like it's shooting anywhere. Okay, if it is, then I wouldn't go to the second step here, which is adding a little bit of overpressure. This overpressure can help sometimes by making the muscle stretch a little bit deeper. Now, some people will feel this start to go into their shoulder blade. If this is the case, this is not the right exercise for you. There's other exercises we can suggest to you, but this is probably not going to be the one. Ideally, we want to feel like a deep stretch into this region here. Then we're going to change sides. Again, test the water, look down first, look into the opposite armpit, just hang out like so, and come back up. Straight down, opposite armpit, hang out just like so. Test the water. Again, if it's zingy, don't go any further until you test the water and it's not zingy anymore. Once it's not zingy, you can go a little bit deeper stretch there. I wouldn't crank on this thing, all right? I feel like people, common thing they do is they just start yanking real hard on this. I wouldn't do that. I would just do touch and go. If I were to grade this on a scale of 1 to 10, 10 is a lot of overpressure. I'm giving myself like a 3 or 2. It's really not that much. Okay, so these are the basic starting points here. A little bit of levator scapula stretching, just following suboccipital muscle stretching too. The next one we're going to go over is some pec stretching. This way, a nice way to do it is going to be here, like you're in prison, and you're going to try to push your elbow points back behind you. So it's going to be just like so, okay? When you're doing this, you may feel one of two things. You may feel your shoulders start to engage. In that case, do the opposite of shrugging, and then try to push the points of your elbows back behind you. Or if you feel like this increases your problems, just relax the shrug and just do a normal version. You'll probably start to feel it kind of lower into your shoulder blades, while some of you will feel like there's a stretch in this region too. That's okay. Both of them work really, really well, and we have to open up the chest. We're going to open up the chest to stop that forward rounded posture that oftentimes goes along hand in hand with upper cross syndrome and stiff necks. All right, the last one we're going to do is going to be an upper trap stretch. For this one, I go hands on hips just like so. Put a little pressure into your fingers with using your guts. And you're just going to be like, I call this the curious dog. You know, you say, you want a cookie? And they're like, you know, but don't go as quick as they are. We're just going to go side to side, and we're going to spend 1 minute going side to side. Now, if you have some dizziness or vertigo or spinning, this is not one you're going to want to be doing because this might actually increase stuff for you. If you do have those symptoms, you may want to talk to someone about them. There's a lot of things that can create things like vertigo and headaches and spinning and so on. Okay. Resist the urge to fall over with your head. You're just going to do some light, gentle mobilization as we start to actively elongate the upper trap muscle. There we go. Now these are the exercises we encourage people with neck stiffness to do when we see them at performance place a lot of times. Not all the time, but a lot of the times. So I want you to consider doing this for about a month and talk to your doctor and make sure that you've been cleared for this type of exercise. But use the countdown timer, bookmark this video, and this may be something you want to use and come back to on a daily basis. Now for those of you who are interested in why these exercises are helpful and more about what's going on, after this section we have an anatomy lesson, a short one, as well as a mechanics lesson, so you get a better idea of why this type of thing starts to occur and what you can do to get rid of it, other than just doing the exercises. This is only part one of recovery. With neck stiffness, oftentimes there's a few driving factors associated with it. Tightness of the neck muscles is oftentimes what we call it, it's called tonic dominance. There's certain muscles of the neck and of the body which tend to overwork. And they're the ones that oftentimes people will say, well, this is always tight. My upper trap, my levator scapula is always tight. My suboccipitals are always tight. My pecs are always tight. And so there's certain muscle groups that are always tight on people, and you got to ask yourself why. Well, this oftentimes comes down to poor stabilization of the opposing groups or the helpers, but also too, it comes down to posture. We all know posture is important, but how important is it? Well, in the case of neck problems, it actually is pretty important, because as you look at my upper back here, this spinal round zags, and in order to look up, I have to zig. And as I start to do this, I'm tightening certain muscles, I'm tightening my pec muscles, I'm tightening these muscles on top, and these muscles are becoming overworked throughout the day, essentially creating what we call an upper cross syndrome. An upper cross syndrome is, again, where those certain muscles become tight and the other ones become weak. So the other part of this puzzle to actually make it so these things don't return after doing specific stretches is to get the other muscles to help while we're lengthening those other muscles as well. Now at the end of this educational section, I'm going to show you one of my bonus exercises that I think can be very helpful to reduce reoccurrence of neck stiffness. The exercises in the video are intended to decrease the amount of stiffness that you have when you have it, but on the days when you feel good, then what do? How do you make this thing stop coming back? Like, I'm tired of it coming back for me. How do we stop it from coming back? The answer is doing the exercise at the end of this video, so stay tuned for that. Now the bonus exercise I want you guys to use, this is called Brugger's exercise. This is a CLX band. It's a style of a TheraBand or a stretchy band. The brand of band doesn't really matter too much, but I like these because you can stick your hands in the middle of them. And the way this is going to work is you can put it on your work desk, and it'll remind you every single day that you need to be doing these. These don't tend to hurt. Again, as I mentioned earlier, these are a scenario where you're trying to build strength, increasing the amount of strength into the muscles that are lagging in the lower cross scenario. We've already done a good job of stretching some of the muscles that become tight, but we need to strengthen the ones that have become weakened. And that, in a nutshell, will help you out over the long term. So the first thing you want to do is provide a generous stretch on the band, but also sit up nice and tall when you're doing so. Okay? It's almost like you have buttons in your shirt here, and you're trying to show the buttons off to the world because they're the coolest buttons that you've ever had. They're almost like a diamond or a pearl. It's like a rare pearl. You want everyone to see it. Okay? When you do this exercise, you're going to spread the band away from each other and then push the band away from your body and return and return. Notice my buttons didn't change position when I'm doing this. I'm spreading, pushing, pulling, returning, spread, push, pull, return. The buttons aren't changing positions. So ideally what we want is we're going to strengthen the middle trap, lower trap. We're going to strengthen the deep neck flexors, and we're going to improve our posture all in the process. So this is a really simple exercise to do a few times a day. Normally a good duration is about a minute or so. I know a lot of people are on Zoom calls or phone calls or conference calls. This is so easy to do, but challenging to where you can still hold a conversation like I am, right? So the magic's going to be in the dosage. It's creating a good spinal hygiene, if you will, as Stuart McGill says. So spinal hygiene is almost like flossing and brushing your teeth every day. If you don't want cavities and problems like neck stiffness to come about, having good habits and good spinal hygiene is a cornerstone in making it so it doesn't return. If you guys want help with neck stiffness and you want a specific exercise program for you, we can do that at Performance Place Sports Care. We have customized programs. We see people in person and virtual as well. So reach out to us if you have those questions. If you want more YouTube videos on neck stiffness, we do have ones, and I'm going to supply a link to them in the corner here. We'd love for you guys to watch them, subscribe to the channel, and share this with someone who you think needs it.